So I believe we are now live again. Can I, from my side, just very briefly say a great, big, warm welcome to all of you from all over the world. You will be amazed to know how many hundreds of you listened in yesterday. Over 1,000 people actually participated in yesterday's session, and we're fully expecting similar numbers again today. So welcome aboard, but let me ask our chair for the Vector Control Working Group, Dr. Mohammed Mukhtar, to extend a formal welcome to everyone participating today. Dr. Mukhtar, as I said, is our chairman of the APMEN Vector Control Working Group, but in his real hardworking real life, Dr. Mukhtar is the director in the Directorate of Malaria Control, Ministry of Health in Pakistan. And aside from his responsibilities with malaria control, he's also responsible for other vector-borne diseases such as leishmaniasis, filariasis, and I may be missing some others as well. But we are privileged to have Dr. Mukhtar with us again today, despite his heavy workload. He's joining us again today. So Dr. Mukhtar, if I may ask if you can just extend a few words of welcome to our esteemed participants.
Thank you, Dr. Liu. Very good morning, good afternoon, good evening, according to your time zone. And it's my highest level of pleasure to welcome all of you on the second day of this extremely important virtual meeting on vector surveillance. As we all know that vector surveillance is a cornerstone in fight against the malaria and other vector-borne diseases. And these illnesses not only cause a considerable morbidity and mortality, but also place a heavy burden on the healthcare system and economies of the poor countries, and most of us belong to this category of the countries. In this meeting, we have a common goal to strengthen our understanding and efforts in monitoring the vector that transmit the diseases, which continues to pose a significant public health challenges globally. And we all know that effective surveillance for which what we are learning here to enable us to detect and respond to changes in the vector population dynamics and the behavior promptly, which is a crucial for timely intervention and the outbreak prevention. In today's session, we will continue exploring the latest tool, methodologies, and strategies for vector surveillance, emphasizing the integration of the innovative technologies and data-driven approach. I encourage all the participants to actively engage, ask the question, but only in the Q&A section, chat box, not in the chat box, and contribute your highest level of insight. Last but not least, we must be very proudful to Dr. Neil Lobo for his outstanding talks yesterday and ahead as well. Thank you all of you for your dedication and active participation in yesterday's session. And I'm sure that the same spirit of professionalism will be continuous even today and tomorrow as well. So thank you very much, all of you, for your participation. And now I hand over to Dr. Liu for further proceeding. Thank you very much, all of you.
Dr. Mukhtar, thank you so much for those very warm, appropriate words of welcome to our esteemed participants. And again, it's a privilege to work with someone of your stature, knowledge, wisdom, and so on, and experience. So thank you, Dr. Mukhtar. And I echo your words that we are very grateful and thankful for having someone like Neil to present this course. Neil, I repeat again, in my humble opinion, is the top world exponent expert in the theory and practice of vector surveillance. So we're fortunate that he has made his time available over 3 days to share those lessons. Let me just remind us of the flow and the process of this webinar. So it is being recorded. Day 1, 2, and 3, everything is being recorded and it will be placed on the APMEN YouTube website. So anybody can go and access the lessons again subsequently to refresh their memories or share that with colleagues and friends. May I remind everyone also, please do not put your questions in the chat box. There are already 650 of you attending this session. It's going to, you can see the needle going up and up and up, more and more people joining. So we cannot cope with checking the Q&A box and the chat box. By all means, please feel free. Chat as much as you would like in the chat box, but for your questions, please put them in the Q&A box, and we will get to them at the end of the afternoon's session. What else did I have to say? So some of you yesterday had the problem that you couldn't see Neil's slides. So I can't see it right now, but somewhere at the top of the screen, when Neil shares his screen, you will see at the top there are some on in the bar there. There are certain panels there. If you can't see Neil's slides, click on towards the top in the middle, Neil's slides. Click there, and then the slides should become visible. Only a few of you had that problem, but of course, to those people who can't see the slides, it's a serious problem. So the way it's going to work is we will have 60 minutes, 1 hour of presentation by Neil. Then we break for 10 minutes. Everybody go to the bathroom or have some tea or whatever. Then we rejoin for another 60-minute session, followed by a 20-minute question and answer session where Neil will directly respond to a selection of the many questions that were being posed in the Q&A box. Do not worry, all questions will be responded to as soon as possible. We're not going to forget about your questions. Those that we cannot deal with in the 20-minute session, you will be responded to at some point over the next few days. So please feel free to put questions, but put them in the Q&A box. Thank you so much. Over to you, Neil.
Hey everyone, hope you're doing well and had a good rest yesterday, and looking forward to going over these presentations today. As yesterday, please be patient with me while I switch between slides and everything, and I will jump straight into it. So if you remember yesterday, I ended with this completely awful slide that shows you my horribly mosquito-bitten leg. Do y'all remember this? I hope you do. But anyway, so this was when I did HLCs, right, in Papua, Indonesia, and I got chewed up by mosquitoes, and I realized that I was the one sitting outside getting chewed up by mosquitoes, but the community was actually inside their houses, protected, hopefully under bed nets. So all the data I was collecting outside was not representative of what was happening to the community. And historically, we have been using this HLC data or CDC light trap data to represent what is happening to the community. And we realized this was probably not completely parallel. So April Monroe, who's crazy smart, she and a couple of other scientists decided to try and figure out how to do this. And so this is where the human behavior observations start. We used human behavior observations to figure out how to understand what's actually happening to the community. So now in this little section, we will go over how to integrate both human and vector data together to understand what's happening to the community. Where are the gaps in protection where people are getting bitten by infectious mosquitoes in the community? And in short, I know you remember this figure because we did this several times yesterday. Uh, Interventions target-specific vector behaviors, and interventions protect humans from mosquito bites when the human behavior, the vector behavior, and targeted by the intervention, when all those three overlap, correct? So you get protections in that middle place when all three overlap. And as I mentioned yesterday, what we want to understand is not just how much, where, and when we are protecting people, but also where we are not protecting people. Where are the gaps in protection? So in this section today, we will go over how to understand the overlap between the intervention, human behavior, and vector behavior, where we can understand both protection and gaps in protection. So human behavior observations. To us, it's an important component of entomological surveillance. We really would like every single Ministry of Health to incorporate this into their systems. It actually doesn't cost anything extra, and that always surprises me. It's just a slightly extra effort, but it doesn't really cost too much. HBOs help us identify where and when our community is being exposed to mosquito bites. This demonstrates gaps in protection. We can understand transmission risk of children, of women, of adults, of people with different jobs, because all of them might have different behaviors and are differently exposed to mosquitoes and are differently protected by the interventions that are present. So we can actually compartmentalize our data in a very simple manner and understand how all these groups or a single group are impacted, where they are being exposed to infectious bites, and how to protect them. This can be done pretty simply by either conducting community surveys, which actually requires some effort, or overlapping human behavior observations with HLC collections or with CDC light trap collections. And in this case, it really doesn't cost too much whatsoever and doesn't require that much of an effort. And over here, we would want to measure things like when and where people go to sleep. Are they going to sleep inside? Are they going to sleep outside? What time they go to sleep? Early in the evening, in the middle of the night? Are they awake all night long? As well as what interventions they are using. Are they under their bed nets? Are they not under their bed nets? So in this way, we can overlap these behaviors. Where are they? When are they there? Are they asleep? Are they awake? Are they using interventions? Are they not using interventions? And overlap this with the human behaviors to understand where and when actual exposure is happening. Sorry, not human behaviors, with mosquito behaviors. I'm getting ahead of myself. So to go over this, I used to explain this in one slide, and I realized even I was getting confused. So I had to break it down into several slides so that I could understand this better. Because even though the publication can be pretty complicated looking, it's actually quite simple. So let's look at this data now. On the left picture, we have a house with an HLC collector inside. And you can see the person sitting inside collecting mosquitoes, and there's a mosquito trying to land on him or her. And on the right, we have a person outside doing the HLCs. So we have an inside HLC collector and an outside HLC collector. And let's assume in this 1 hour, let's say we're only looking at data for 1 hour. Let's say it's 12 to 1 in the morning. HLC, but let's say at 1 to 2 in the morning. Indoors, this person on the left collects 20 mosquitoes. And this person on the right collects 10 mosquitoes in that hour. So the assumption, and historically what we have done, is assumed that the human biting rate indoors is 20 mosquitoes per person for that hour, 1 to 2 a.m. And outdoors, it is 10 mosquitoes per person per hour outdoors for a person, right? So this is how we have assumed things. And as we went over in the previous slides, this might not represent what's happening in the community. So let's try and understand what might be happening in the community. So now let's take away our HLC collector because we have our data, right? We have 20 mosquitoes in and 10 mosquitoes out for that hour. Let's take away the mosquitoes. And now let's look at our community. Now, in our first example, now we're going to work through several examples so you can see how we build up on this data. Let's say there are 4 people in the community. We're going to use just one household, but assume this is community-wide. And all 4 people are indoors and they are hanging out from 1 to 2 a.m. Yes, in this picture, you can see they're standing in a corner. And now we have our indoor biting rate and our outdoor biting rate. So look at this now. In our community, 100% of people, all the people are indoors. So 100% is equal to 1. So our indoor biting rate is 1 times the biting rate, which is 20. So our human behavior adjusted biting rate is the proportion of people of the community at that location with that behavior multiplied by the HLC or CDC light trap based landing rate, right? So that's 20. So 20 times 1 is equal to 20. So now the community exposure indoors is 20 mosquitoes per person for that 1 hour, 1 to 2 a.m. But now let's look outside. Are there any people outside? And the answer is no. So 0% of people are outdoors. So now our outdoor biting rate, even though our HLC collector collected 10 mosquitoes, our outdoor biting rate for the community is 0. I hope that makes sense, right? It's pretty simple. 100% of people are inside, they will get bitten. 0% of people are outside, no one will get bitten. So now, when we look at our human behavior observation-based biting rates, so we're looking at community exposure. Outdoors, there's nothing. But indoors, it is 20 mosquitoes per person per night. So if we make a pie chart, all the exposure in this example from 1 to 2 in the morning is happening indoors, and the biting rate is 20 mosquitoes per person per night. For that hour indoors. Now, this is our first step. Now, let's try and make this slightly more complicated because you know that it's always complicated in the field. Now, we have the exact same biting rate, 20 mosquitoes indoors and 10 mosquitoes outdoors. Now, in this community, from 1 to 2 in the morning, 3 people are indoors and 1 person is outdoors. And
Neil,
if your brain is running ahead, you will know exactly what we're going to do, right? So
Neil,
the
can I
indoor
interrupt
biting,
briefly if you don't mind?
of course,
I'm very
yes.
sorry. So these are people joining late that didn't hear my initial comments. So for those
Sure.
that have joined subsequent to the introductory remarks, and you can't see Prof. Lobo's screen, please go to the top of your screen there, and towards the middle, you will see there Prof. Neil Lobo's screen. Please click on that. So if you look right at the top, there's a horizontal bar there. It says on the extreme left, Zoom Workplace. Next to that on the right to it is Webinar. And then there's Prof. Neil Lobo's screen. Click on that one. Sorry, Neil. Sorry about that.
Oh, no, not at all. Please don't apologize. It's our jobs. Okay, if I may continue. In our second set, now we see that there are 3 people in the community indoors and 1 person outdoors from 1 to 2 in the morning. The HLC rates remain the same, 20 indoors, 10 outdoors. And in all these examples, we're going to be keeping the exact same HLC-based indoor biting rate and outdoor biting rate. So in the next few slides, this is going to remain constant. So now with the 3 people indoors, that means 75% of people are indoors. 3 divided by 4 is 75%, which means now 75% of the community, or 0.75 of the community, is indoors. So now let's multiply that biting rate by the indoor biting rate. So 20 times 0.75 is equal to 15. So now 15, the human behavior adjusted biting rate indoors is now 15, 1.5. Now, if we look outside, there are 10 mosquitoes, and there's only 1 person outdoors, right? And that's 25% of the community. 1 divided by 4, because there are 4 people in this community, is 0.25. So 0.25 divided by 10 is equal to 2.5. So now we have the human behavior adjusted biting rates, or exposure for the community, is 2.5 bites per person for that hour outdoors and 15 indoors. I hope that makes sense. Now we're going to make this slightly more complicated. So it's the exact same biting rates, and those 4 people from 1 to 2 in the morning, 2 of them are asleep under bed nets, 1 of them is not asleep under bed nets, and 1 of them is outdoors. Now we have 3 behavioral groups here. Outdoors, awake, indoors, asleep with bed nets, and indoors, asleep without bed nets. And in this example, in this step, this is where you can see how these human behavior observations can directly translate into decision making for the Ministry of Health. So now, of these 4 people in our community, 50% of the community is under bed nets, which is 0.5. 25% of the community, which is this person over here without the bed net, is not under bed nets, and that's 0.25. So we look at the 50% of the people under bed nets, we multiply 0.5 by the biting rate, which is 20, and that's equal to 10. So we are preventing 10 bites in that community. Bed nets are preventing 10 bites in that community for that hour. And that's the protections that bed nets afford us. Now, the person not sleeping under the bed net, that's 0.25, 25%. We multiply the number of mosquitoes, 20, by that rate of mosquitoes, of humans in that behavioral group, which is asleep, not under bed nets. And that is 5. Asleep, not under bed nets, the adjusted biting rate is 20 times 0.25 is equal to 5. So there are 5 bites for people asleep, not under bed nets. And outdoors, we have the same thing as the last example. There's 1 person outdoors, that's 25% of the population or the community, and the biting rate outdoors, the adjusted biting rate outdoors is 2.5. Now, if we put that in a pie chart, all these 4 behavioral groups, we see the community, there are 10 plus 5 plus 2.5, 10, 15, 16, 17.5 bites in that community per night for that hour. Sorry, for that hour, not per night. 10 of those bites are prevented by bed nets. 5 of those bites continue happening for people asleep not under bed nets, and 2.5 bites are happening outdoors. Now, this is where it gets important. So now 5 bites are happening indoors when people are asleep without bed nets. As a Ministry of Health, you can say and you can think, I can prevent these 5 bites if this person here, who's not under a bed net, uses a bed net. Immediately, you can see how you can optimize the intervention of bed nets. And this is actually based on what's happening to the community. So you can prevent 5 bites for that hour out of 17.5 potential bites, right? So you can reduce biting, severely, quite a lot with improved bed net use. So if we look at just exposures happening, I've basically taken out the 10 bites, the bed net protection. This now is our gaps in protection. 5 bites are happening indoors when people are asleep without bed nets, and we can reduce that by increasing bed net use. And 2.5 bites are happening outdoors. And in this simple example, if we make this 5-0, if this person over here without a bed net uses a bed net, the remaining gaps of protection will be 2.5. And that's what we've got to deal with. And that will be residual transmission after maximizing and optimizing our bed net strategy in this specific example. Now let's make this more complicated because, it's good to make things more complicated. And I know you can do this yourself. So let's say that, again, those same 4 people, one of them is outdoors, one of those is inside awake, one of those is inside asleep without bed nets, and one of them is inside asleep with bed nets. Even I get confused now because there are just so many behaviors, but it's actually not that difficult. And now we have 4 behavioral groups: inside, outside, asleep without, and asleep with bed nets. And we do the calculations exactly the same way. Let's get done with the outdoors first. Outdoors remain the same HLC biting rate. 25% of them are outdoors. The biting rate outdoors remains the same as the previous example. It's 2.5, which is 10 times the proportion of people outdoors. If we go indoors now, there's 25% of people in each behavioral group, which means 0.25 times 20, 0.25 times 20, and 0.25 times 20, which is 5, 5, and 5. And here is what happens, and here is what we see. 5 bytes of 5, 10, 15, 7.5, 17.5. Of 17.5 bytes, 5 of the bytes are prevented by bed nets, right? And if we look at gaps in protection, that's what it looks like, right? So 5 bytes are happening indoors when people are asleep without bed nets, and we can reduce that by increasing bed net usage. But here, these 5 bytes, the blue ones, they are people awake without bed nets. How do we reduce that, right? And now is when we can see at this hour, the person is indoors without a bed net. He or she is awake. We can't give them a bed net. So can we have any other intervention that might work there? Perhaps a topical repellent, perhaps a spatial repellent, perhaps something else, right? Now, here is where we have to think through the processes and see how we can adapt to the community, how we can protect these 5 people. And the same applies to the person outside, the 2.5 bytes. How can we protect that person? So I hope you can see that just based on looking at intervention use, human behaviors, and the vector behaviors, which are our HLC rates, how we can understand what is happening to the community. And each of these examples, please remember the HLC rates were exactly the same, but the community and their behaviors in every example completely changed where and when exposure was happening. And each example, what we might optimally do to protect them would be different, even though we had the exact same vector behaviors. So here's where, and I hope you get this, here's where understanding human behaviors enables us to better make decisions, better protect people based on their behaviors. Different communities have different behaviors. And all of a sudden, now, if you look at people sleeping outdoors, I just had the single person sleeping outdoors. Right now, in this example, there are 6 people, and they're the exact same behaviors indoors and outdoors. They're sleeping outdoors with and without bed nets. They're awake outdoors. Now you can actually figure this out, right? I hope you can now, and I'll go through how we may support you doing that. So there are different behaviors in different communities, and understanding what our community is doing will tell us where and when to protect them. Now, in this example, it was just 1 to 2 a.m., and I used one sort of person, one kind of person. Now, imagine you can collect this data for men, for women, for children. Let's say children who are 10 to 15 are the highest exposure. They have the most malaria. You can actually go into the community, collect their behaviors, and understand where and when they're getting exposed. Suppose men above the age of 20 are the ones who get the most malaria, and you might be able to do the same for them. If you collect all the data, you can understand the different exposure profiles across your community without too much of any extra effort, because none of this actually, it sounds like a lot, but it actually is not much of an effort. You can collect your data based on age, based on sex, based on vacation, a whole bunch of things. And here's an example of, if you remember, this data is just for 1 hour, from 1 to 2 a.m. Now, in this next slide, this is an example. This is throughout the night. So let's see, where is 1 to 2 a.m.? Here. This column over here is human behavior. This is the raw human behavior. All the bars are human behavior. And let's say the y-axis on the left is the proportion of people in each of the behavioral groups, right? So from 1 to 2 a.m., the black is people outdoors, they're asleep without bed nets. And over here, the crosshatch is people asleep with bed nets. As a note, the gray is people awake indoors. So for this 1 hour, we have the data. Now, if we collect this data for every hour, you can see the behavioral profile of that community across the night. You can see the black is people awake outdoors. The gray is people indoors awake. The crosshatch is people asleep under bed nets. And the dotted section is people asleep not under bed nets. Now the lines, the red line is the HLC biting rate outdoors. The blue is the HLC biting rate indoors. And oops, sorry. And you can see there's a higher biting rate outdoors and a lower biting rate indoors. And of course, the y-axis is 6 p.m. all the way to 6 a.m. on the right. And this is the raw human behaviors and the raw mosquito behaviors. Now, when we analyze these together, as I mentioned in the last few slides, we look at the adjusted biting rate. The adjusted biting rates based on human behavior combined with vector behavior. This is what we get. In this figure here, if you remember the pie chart, we did it by hour, but this is over the whole night. Here we've combined human behaviors and vector behaviors. The red is exposure happening outdoors. The blue is exposure happening indoors without when they're awake and not under bed nets. The light blue is when they're asleep with bed nets, and the crosshatch is when they're asleep. Sorry, I'm confusing things as usual. The blue is when they're asleep without bed nets, and the crosshatch is when they're asleep with bed nets. And now you can see if you increase bed net usage, you might only protect the light blue section more, right? And the light blue section is about 15%. I'm approximating here because this is an example. But you can see most of the gaps in protection in the figure above. We have added up all the exposure for every hour to create this pie graph. So most of the exposure here, 75, 78% of it is happening outdoors. About 20% is happening indoors before people go to bed, and about maybe 15% is happening when people are asleep without bed nets. Now, with just this example, we can go to the Ministry of Health and say, all our exposure, 75% is happening outdoors. We need to do something about that. What intervention do you think we can use, right? For the dark blue, indoors awake without bed nets, or we can't really give them bed nets, what can we do to protect that proportion of people? So all of a sudden, with this sort of analysis, we can understand the potential of interventions in different places and times, and what proportion of people we might be able to protect. And outcomes like this can directly impact program decision making. I hope this is clear because this has been so important for me in trying to understand, again, how to protect our communities. So how do we calculate this? So the calculations, and I understand this might be new to a lot of y'all, and we don't have the time to go through the direct and very detailed calculations, but I'm happy if you'll email me, I'm happy to send y'all all the adjusted exposure calculation sheets and everything. And in fact, I've packaged them together already, and these will be distributed to you all and shared with you all along with all the other slides as usual. So there is a publication on this. It's called Methods and Indicators for Measuring Patterns of Human Exposure to Malaria Vectors. The primary author is the very, very smart April Monroe. And the calculations are, now this is what freaked me out when I first saw this. This is just part of the calculations. And when I see things like this, I get scared. I'm being completely honest. I look at this and think, I do not want to do this. I am not that smart. Do not have a PhD in mathematics. I want to run away. And I assume a lot of you would want to do this as well. So how can we make this simpler? So what we have done at MEI, at UCSF, we have made a calculation sheet that's automatic with examples. Now, actually, there's a whole bunch of slides on this, and each slide explains exactly what to do. I'm not going to go into it, but this will be shared with you. So the next slide is actually hidden, but there are all these slides stepwise on how to do this. In the top section is your ento data, and all you have to do is put in your biting rates or your landing rates or your entomological rates by hour. The second step is putting in your human data, which is just your proportion of people in each behavioral category. Are they inside? Are they outside? Are they awake? Are they asleep? And then the next step is you do nothing. because everything else is calculated for you directly. These figures are automatically generated, right? And there are all these calculations that are all automatically calculated. So you don't have to do anything. You do not have to get your PhD in mathematics to do this. And thankfully, I didn't either, because I'm not good at math. But all this is automatically done for you. It will be shared with you. And if you have any questions, and if you wanted me or anyone on the MEI team to go over it with you, please message us. And all our information has already been shared. So this sheet, for example, on the left, you can see the colors are different and there are a lot more categories because you can add categories such as people asleep outside with and without bed nets. You can add categories or do the analysis for men, for women, for children, for different behavioral groups. So all this can be done by adapting the sheets that we will share with you. And if you have any questions, please let us know. It's our job to support you, and we will happily do that. So here, I hope you can see how it's so important to integrate not just human and vector data, but also entomological surveillance and epidemiological data, right? Entomological data only tells half the story. It doesn't tell the full story. Epidemiological data also only tell half the story. A lot of people focus on the epidemiological data because that's what people want to see, right? People want to see the amount of people getting malaria, the death rates, and things like that. But it's only half the story. Unfortunately, as I mentioned earlier, a lot of people who are, let's say, physicians or people who really study human beings and malaria focus on the human aspect of things. But we, as entomologists or people who are conducting entomological surveillance, can really do a much better job if we understand our data in the context of other data. We can be better scientists. We can be better decision makers. We can produce better data and evidence to make better decisions. And we can do this by integrating different data sets, right? So if I'm just looking at ento and epi data, we can add in rainfall and climate data, like when a mosquito is biting, when is malaria happening, when should I do my surveys best, right? Vector control intervention data. Malaria is going down. Is it because of rainfall or is it because they just distributed bed nets? Right? These are just example questions. If we understand these things, we can do a much better job and understand the system, our transmission system, much better. Human behaviors. I'm not going to say why. I'm sure you just hopefully understood why it's so important. Operational inefficiencies. For example, if there are ACT stockouts, right? And malaria has gone up all of a sudden, and your boss asks you, why is malaria gone up? What's happening with entomology? Are the mosquito numbers going up? And you can say, actually, there's a stock out of ACTs, and we can't treat people, right? And let's say there's changes in risk. Let's say seasonal migration of herders or farmers or cow herders, and they are bringing in malaria or they are taking malaria to other sites. Like in some sites, it's really people are wondering why at Christmas time malaria went up, and that was because at one of these sites, people who were in high malaria regions were going back home for Christmas or going back home for Eid, and they were taking malaria with them. So they were taking malaria and distributing it across the country when they were going home. And things like this can completely start outbreaks. And if you understand what's happening, you can see what to look out for. You can be better prepared to protect your population. So now if you look at the ESPT, table 5 on page 14, I hope you all downloaded it. I hope you went to this, I hope you Googled ESPT and MEI, and you should go to the page where you can download the PDF version. If you look at table 5, you can look at vector behaviors that are targeted by specific interventions. For example, bed nets, as we know, target insecticide-susceptible indoor, late-night human-biting vectors, right? And so we go through each of these interventions, and you can actually see which human behaviors are targeted and vector behaviors are targeted by those interventions. So when you map your intervention over to your gaps in protection, if remember the previous example of human behaviors and the gaps in protection, we can understand which of these interventions are doing and what vectors are doing. So you can reference this table 5. There's another table if you're looking at indicators, minimum indicators. I'm not sure if you remember, because yesterday is when I started the presentation on indicators, and now we are still doing it, still going through the presentation the following day today. And so we're still going through indicators. So if you look at page 16, the minimal essential indicators to determine whether a new intervention should be introduced. And this is the potential of our intervention based on what's happening at our site, based on the gaps in protection at our site. So here are the indicators on the left, and the vector occurrence is one. And here are the interventions on the right, on the top, for example, bed nets. And the green indicates that, or this darker greenish blue color indicates that that indicator might be suitable to evaluate if your intervention has good potential at your site, right? So you can go through all the interventions on the top and all the indicators, the minimal essential indicators on the top left, and the supplemental indicators, or the nice to have indicators down here. Of course, you can see the key here. Yes, you can use that indicator. Light purple, it depends. And dark purple, it also depends based on the resistance to insecticide. So you can work through this table to understand which indicators you can use to see the potential. Now, an important difference between understanding the potential of an intervention before you putting it in and evaluating an intervention after you put it in. You actually might need different indicators. And so table 7 actually goes through the indicators, the minimal essential indicators, to determine or evaluate an intervention that's already in place. And just like the previous table, on the left you have the indicators, the essential ones, the minimal essential ones, and the nice to have ones. And on the top, you have the interventions. And you can work through this if you have an intervention to try and evaluate it. For example, a simple example is IRS, right? Let's say you already have IRS at your site. How does IRS function? IRS functions on indoor resting mosquitoes. And everyone's first assumption is, let's look at the indoor resting rate. Now, suppose you go in to a site with IRS already present, and you look indoors at the indoor resting rate, and your indoor resting rate is 0. Now, what are the outcomes? What is your explanation for that? The explanation might be that your IRS is killing all the mosquitoes, which is why you don't find any mosquitoes, which would be a really good explanation. Your explanation might be your mosquitoes have completely changed their behaviors and are biting indoors and flying outdoors and not even sitting on the walls, in which case you won't know the difference between explanation 1 and explanation 2, right? Are they all dying, or are they all flying outdoors? Or the third explanation might be that they're all completely insecticide resistant and are not even landing on the walls, but not even going inside, right? So there are a bunch of explanations based on the data you find. And so you have to choose your indicators carefully to ensure that they are answering your question appropriately. And I'll actually go through this specific example in a couple of slides, or on the next presentation. I don't remember, but it will come up. I will show you how to do this, or at least how we did this. So the selection of the appropriate indicators, as I just pointed out, is essential in answering your question, right? We want to select our indicators based on our program question. And if we pick a minimal essential set, a high impact set, it'll avoid unnecessary data collection, unnecessary funds, unnecessary capacity that may be required to collect all these indicators. Selecting appropriate indicators can capture the human vector interaction. It can capture the true exposure in your community, not just the exposure on the HLC collector, right? The understanding these gaps in protection based on your intervention can inform your intervention choice, and it will also guide control strategies. And at the same time, based on the interventions you have in place, you can evaluate your interventions and also optimize your interventions. And when I say optimize, in one of the examples previously, I talked about how people were asleep indoors without bed nets. You can optimize bed nets by increasing bed net use, which with the social behavior change or SBC strategy, right? And has actually been done. And you can further optimize the tools present without too much of an extra effort, without having to order new tools and procure um, new funds to get new interventions. So it's really important to select your appropriate indicators that can help you understand gaps in protection, etc. That is the end of my slides on indicators. And I will quickly switch slides and have a sip of water and go on to the next step. Where am I? As usual, I am confusing myself. Share. Here we go. Oops, I picked up the wrong slide set. I'm sorry. Please be patient with me. I will blame jet lag for this. I hope this also gives you a breather so you don't have to listen to me nonstop. Oh, and I've actually lost the slide set again. Sorry. Sorry. Yes, I'm still.
Neil,
It's
no, take your time. Take your time. Fully
yeah,
understood.
that's fine.
These things happen. So while you're doing that, Neil, can I just explain to the audience? This question keeps popping up. Many of you are asking that a full set of the lectures and lecture material be sent to your personal private email address. So unfortunately, we can't do it. We can't send everything to 1,000 different individuals' emails. But what we are doing, everything is being recorded. Be reassured, everything is being recorded and it will be placed on the APMEN website. Wulan will put the URL where you can access it so that everyone can go there and you will have full access to the full set of all 3 days of recordings. No problem, but we cannot send it to each individual's email address. Also, again, each person who attended at least 75% of the lectures on each day will get a certificate of attendance automatically generated. The computer will tell us which people have attended all 3 days and 75% minimum of each of the 3 days. Thanks, Neil. I'm not sure if you're ready now.
Yeah, I am. Yes, thank you. I hope you can see the slides. And Leo, just to add to what you said, any slide that I have developed and presented, you are absolutely free to use as your own for other presentations or explanations, or if you want to use them for any other purpose. It would be nice if you referenced that they were from MEI, UCSF, from our efforts, the ESPT, but you are absolutely free to use any of them. You do not have to ask me permission for it. They
That's
are
an
for you to use. Yeah.
extremely generous offer. Thank you so much, Neil, for lecture purposes or projects or whatever. That's an extremely generous offer. Thank you, Neil.
No, not at all. It's our jobs, right? So in our next set of slides, we're going to look at selecting sampling methods and analytical techniques. Now, where are we in the ESPT? If you remember this, we first went over what is your question, and we just went over and finished how do we select indicators. Now, our indicators are selected based on our question. Now, once we select our indicators, we need to figure out the sampling method that will appropriately collect our indicators. And now we will go over the sampling methods. We're here right now. So selecting sampling methods, right? Now we need to select our sampling methods based on the indicators that are based on our question. Now, please remember, just like interventions taking advantage of specific mosquito behaviors, sampling methods also take advantage of specific mosquito behaviors, right? Both sampling methods and our interventions take advantage of mosquito behaviors. And again, remember that each mosquito species has different behaviors. So each mosquito species might interact differently with both your intervention and your sampling method. And I have examples that will come up. Each sampling method has its positive points, its negative points, its horrible points, its ethical points, right? So understanding this is also important when you select your sampling method. You have to make sure that it collects the appropriate indicator as well as it being appropriate for your site, for your country, for your budget, for your rules and regulations. If you look at box 1 in the ESPT, there are the main sort of sampling methods outlined here. If y'all are entomologists, I hope y'all are used to this, but I will go through each one of them. We have our human landing catches, human baited traps, and so on. In Annex 3 of the ESPT, you will have more information on each of the sampling methods, and I think I have a slide on this. So let's start up on sampling methods. The first one, which is considered the gold standard, is called the human landing catch. And over here in this picture, you can see Brandy St. Laurent. She and me worked together on many studies for many years, and here we are in Indonesia, and she is conducting HLCs. Now, the HLC takes advantage of blood-seeking, human-feeding mosquitoes. Those are the behaviors, host-seeking mosquitoes. So human landing. Humans are the bait. We are waiting for the mosquitoes to land, and you can see she has an aspirator in her hand, and there's probably a mosquito sitting right there that she's going to suck up, and that gets captured in this tube, and then we can blow those mosquitoes out in these little boxes that are labeled for each hour, so we can understand the human landing rate for each hour. Yes, if you're not used to this method, entomologists are crazy, which is true. So now the human landing catch is considered the gold standard when we're looking at human biting rate. But please note, as I mentioned earlier on, the human biting rate is not necessarily representative of what's happening in the community, right? Because we have to factor in what the community is doing and their behaviors. And you can see here, Brandy is sitting out in the middle of the night, late at night, collecting mosquitoes outdoors, and I don't see any of the community around her. They might be inside asleep, they might be fishing, they might be doing something else. And understanding that is important. And in each of these each of these methods, I have written out example of a question, question mark. And I would like you to think of an example of a question or example of an indicator you would be able to collect with this. And over here right now, an easy indicator is the human biting rate outdoors that Brandy's collecting, right? And if you look at species of mosquitoes, we can look at the species specific human biting rate outdoors. And I just remembered something that I forgot when I was looking at and explaining human behavioral observations. And that is, I mentioned that we can look at the community exposure based on men, based on women, based on their different jobs and behavioral profiles. We can, excuse me, we can also do the exact same thing for specific species of mosquitoes. For example, we can look at the exposure profiles of the community based on Anopheles gambiae and do the exact same thing for Anopheles fenestus. So we can understand the impact our intervention has on each specific species of vectors. And I think that's pretty brilliant because not only can we understand how to direct interventions to our community, based on our community behaviors, we can also understand how each specific intervention in that community will impact transmission by each vector. And that's, I think, really important. And it's an easy analysis. You just have to do the HLC rate by species. And I'm happy to go over that again if you'll have questions on it. So this is the human landing catch. It is considered the gold standard. It directly measures the human landing rate of mosquitoes on that individual, and this can be analyzed by species. The second method is the human baited trap, HBT. And these traps were conducted for a very specific reason. So with an HLC, sometimes the mosquito gets to actually feed on that person or start to feed on that person, because if you imagine I'm sitting out from 6 p.m. to 6 a.m. when I'm usually asleep, I'm really tired, and sometimes my attention is not that great. Also, it's the middle of the night, right? And so I might not be able to see the mosquito trying to land. And a mosquito might take maybe 10 to 15 seconds to complete a feed. And I need to be vigilant for every second to capture that mosquito. So there's some points where the mosquito might actually probe, and there's a possibility of the mosquito giving that HLC collector malaria, or even worse, another disease, a virus disease, and hence, like dengue or chikungunya. And hence, there are ethical considerations with HLCs. There is not much data on the number of infections, for example, on virus diseases with HLCs, but there is data on malaria, and there are a couple of publications in it that demonstrate that the malaria infection rate on HLC collectors without prophylaxis, without treatment, is about the same as that happening in the community. So there's no additional risk. But then if you hire someone to do an HLC, you might want to protect them. And data demonstrates that you actually protect them far more than the community. So that's a good thing when you give them prophylaxis. So to prevent that, to prevent the chance of any exposure happening, we have the human baited trap. And here we have a human inside a tent that's completely closed and a mosquito cannot reach them, inside a bigger tent where the mosquito can enter, try to feed on this person, but they cannot leave that tent. So you can imagine, if you can see my cursor, here's a mosquito flying in, goes in there, tries to feed on that person, and inside the tent, it will be flying around and rest on the inside of the tent. And every hour, someone else can go in and collect all those mosquitoes. And this is a proxy for the human landing rate. And this will tell us approximately what the human landing rate is for that person, for that hour, or for that night. Right? And again, please think about what a question might be. In the same manner of having a human bait trap, we can have animal baited traps, in which we put an animal in the same tent in the same methodology. And we can look at the animal biting rate. In this example, in the Solomon Islands, we were trying to understand if the mosquitoes preferred feeding on humans or if they preferred feeding on pigs, which were the primary main mammal over there at those sites. And what we found is that the mosquitoes definitely preferred biting humans. In our next sampling method is indoor resting collections. And here we want to find the number of mosquitoes, the indoor resting rate, like what number of mosquitoes and what species of mosquitoes are resting on the inside of structures. And we can do this by PSCs, which are pyrethroid spray catches, or indoor aspirations, which I forgot to list out here. And you can see the lady on the left is doing an indoor aspiration. She's going indoors, and at every hour of the night or every 2 hours of the night, depending on your protocol, she's looking at the mosquitoes resting inside that structure. With pyrethroid spray catches, in the morning, we would go to that structure, close all the windows, put white sheets on the inside of the structure all over, and then spray a pyrethroid or an insecticide and close all the doors again. And hopefully all the mosquitoes that are resting inside that structure would fall down and fall onto that white sheet. And then we would go inside and collect all the mosquitoes. You can see him collecting all the mosquitoes on that white sheet. And we can understand in the morning what number and what species of mosquitoes are resting inside that structure. And my question to you, which you can't answer because of the format, is what would this be relevant to? And the answer is it's very relevant to IRS, right? Residual spraying. We can understand the species of mosquitoes that might be impacted by IRS, the proportion of mosquitoes that might be impacted by IRS. So this specific data collection method is directed towards a specific intervention, IRS. The next method, which a lot of people use, is the CDC light trap. Right? So mosquitoes are actually attracted to light. And it's this light over here. If you haven't seen a CDC light trap, there's a fan. I hope you can see my cursor. There's a fan over here that blows downwards. And the mosquitoes will fly here, come up here. There you can see the little light right at the top here. The mosquito will fly towards the light, get sucked in by the fan, and get blown into this mesh cage. So you can install a CDC light trap over the entire night for 12 hours or for 6 hours or for every hour. And you can see the proportion of mosquitoes that get caught in the CDC light trap. You can place a CDC light trap by a sleeping person to understand the number of mosquitoes approaching that person over the night. And this is a proxy for human landing catches. We can use this instead of human landing catches. It is important to note that CDC light traps usually do not capture the same species and the same proportions of mosquitoes as human landing catches. And understanding the relationship between HLCs and CDC light traps is really useful when you use CDC light traps, because you can then translate your CDC light trap data collection into HLC collections. For example, indoors, every mosquito caught in an HLC is equal to 2 mosquitoes caught into a CDC light trap. And outdoors, you catch 4 mosquitoes in one method and 2 mosquitoes in the other method. So I made up that example, but you can use that translation factor to translate CDC light traps into HLC data collection if you have that conversion factor, and especially if your country or your site does not allow HLCs based on ethical reasons, as I outlined earlier. Based on the site, you can associate based on your question, you can associate your CDC light trap with a human bait, with a cow bait, with CO2 to attract mosquitoes, or with UV light. And different CDC light traps function differently at different sites with different species. So doing an evaluation of this might be really great to see how well your CDC works before you start to study. Now, 4 and 5
Neil,
are associated together, and there are
can I interrupt
Of
here,
course,
Neil?
yes.
Sorry. Yeah,
Yes.
sorry. So time has arrived for us to take a break, but if you
sure.
don't mind, Neil, this is something that has struck me time and time again. We keep talking about the human landing catch. If I may just contribute my little penny. Human landing catch is the gold standard for the very good reason that malaria is transmitted by specific vector species. So if you want to know which vector species are biting humans, your most effective way is to catch the mosquitoes that are attracted to a human bait. You will get a different answer by using surrogate traps like CDC light traps. So that is why the human landing catch is the gold standard. You know exactly which species are attracted to humans, when during the night, and at what rate. But to get an accurate answer, you need to use the human landing catch method effectively. This is the point I wanted to make, Neil. And that is that studies in Africa have shown that more than 96% of Anopheles arabiensis, Anopheles funestus, Anopheles gambi sensu stricto If you're standing or sitting outdoors with bare legs, bare arms, bare pate of head, and so on, 96% or more of those vectors will bite you on ankles and feet. That is why across the world, people who are doing human landing catches only expose their ankles and feet, because the wisdom of decades of experience has shown that that is where the mosquitoes bite. But this is my final point. You have to have your ankles and feet on the ground, because it's not the ankles and feet so much that are attracting those mosquitoes. It's height above ground. You can take that very same person, get them to strip down to their underpants and lie down flat on the ground, and lo and behold, those same mosquitoes will now bite across the entire body. It's not the ankles and feet, it's the height above ground. So when Brandy raises her legs onto a platform, first of all, she's creating a space, which is a critical factor. So I thought I'd just mention that. And also, some people only use one leg and one foot. So you're going to get a different answer to a person who's used two legs exposed. And you want to be able to compare apples with apples. So when you do a human landing catch, put your ankles and feet on the ground, use both legs, and do not wear sandals. Your feet must be bare. Sorry, Neil, I just wanted to make that point. So can we break for 10 minutes
Sure.
and then we reconvene? Thank you so much, everyone. Sorry about belaboring that point, Neil.
Oh no, thank you, Leo. That is important. Thank you. And correct. So 10 minutes.
Okay, thank you, everyone. Hope you had enough time to do whatever you needed to do, make some tea or coffee or go to the bathroom. Welcome back again to this very enjoyable, highly informative, highly professional presentation by Prof. Neil. More questions are being raised about availability of the slides. Let me confirm again that we unfortunately cannot send everything to a specific email address. There are many of you asking that, but be reassured everything is being recorded and it will be made available on the APMEN website. Either Wulan or Dr. Porn will put in the chat box or somewhere, or we'll put it on the screen periodically where you can access the recordings. The URL will be provided to you. So welcome back, everyone. Back to Neil. Thank you, Neil. Just a reminder, we'll have a 1 hour session now. After 6 minutes, then we'll go over onto a 20-minute Q&A session.
Sounds good. Yeah. I hope everyone had a good break. I was trying to answer questions. I hope you'll see my slides. Let me know if you do not. So we were going over sampling methods. On this slide, we go over two more kinds of sampling methods, which are the human and animal baited traps. Now, these are similar previous ones where we are using our target bait, which can be either a human or an animal, and we use their odors to attract these mosquitoes and capture them. So mosquitoes are attracted to a couple of things. And Frances, who you can see kneeling down here, actually studied this. And she realized that was attracted to shapes, to larger shapes, for example, that of a cow. And the darker the shape, the more they are attracted to it. They're also attracted to heat because we're mammals and we produce heat. They're attracted to carbon dioxide, to the smell of that specific bait. So they're attracted to, for example, cows more than humans because cows smell different than humans. I hope, with most of us. They're attracted to humans more than other animals because they prefer the smell of humans. And there was a question about if mosquitoes are attracted to some humans more than others, and the answer is yes. Slightly different than others. And so mosquitoes are attracted to some humans more than others. And for example, love me, and I hate them. But mosquitoes are very attracted to me. But in this example here, this host decoy trap uses a tent in which we have a human or an animal, something in there. We can put them there over the night. And there's a tube here that pushes the air through. And so at the end of this tube here, we have all the odors and the carbon dioxide from the bait, which might be a human. And it comes out here, and you have a drum filled with warm water to represent both the shape of an animal as of an animal. Sticky tape here. So the mosquito will see this shape, feel heat, and smell the animal and come here and land on the sticky tape and get trapped. So we use this using the cues that mosquitoes follow to find a blood meal to sample mosquitoes. We can use humans or animals. In the next example of a trap, which is similar, is OBET, which is the odor-baited entry trap. In this method, you can have a tent. In this tent was a cow, and I can tell you it was ridiculously difficult to get into that tent. Not one of the us. And here we have a the rest
Neil, we're having connection problems. Can you hear me, Neil? Neil, yeah, we're having connection problems, Neil. To our audience members, can I ask you just to be patient for half a minute or a minute? I'm sure we'll reestablish contact soon. Neil is in Uganda. I'm not sure exactly where, but presumably his connection is not very strong. So let's just give him a few seconds and hopefully the connection will be reestablished. There you are. Okay, Neil. So as said, your connection was a bit wobbly there. Thank
Oh,
you.
I'm sorry, very sorry about that. I do not know what happened, and I moved across my room, and hopefully it is better now. That's the first time it's happened. Well, hopefully the first and last time. I will share my slides again. Uh, I hope you can see these. And now we are looking at we will continue. We are looking at outdoor resting collections. And in this method, we try to capture mosquitoes that are resting outdoors. We want to see where and when mosquitoes rest. Mosquitoes usually rest after a blood meal to digest the blood meal and to the ability to form eggs from that blood meal. So there are multiple methods here. There are pit traps in which we dig pits, and there are little indentations in that pit where mosquitoes might rest. There are pot traps. There are several different kinds of traps. And in my experience, these traps have never been that efficacious. And based on the question we are trying to ask, it's actually quite easy to get this data without conducting these sampling methods. And here is where we are thinking around what is actually happening. For example, if we know the number of mosquitoes approaching a house from our indoor HLCs and our outdoor HLCs, this is just an example, and we know the indoor resting rate with our PSCs or our indoor aspirations. So every mosquito, and let's say 20 mosquitoes approach a house. If we catch 5 mosquitoes resting inside houses, we know of the 20 mosquitoes approaching a house, 5 are resting indoors. So where are the remaining 15 if they're not in the house? If they are not indoors, they are probably resting outdoors. That's the only other choice. So we automatically know the outdoor resting rate by understanding our indoor resting rate and the mosquitoes approaching a house. However, if we want to understand where and when mosquitoes are they resting under bushes? Are they resting in the trees? Are they resting in pits? Then we might want to conduct suitable outdoor resting collections. A carbon dioxide baited trap uses carbon dioxide to try and capture host-seeking mosquitoes are attracted to carbon dioxide. We can use this in multiple ways. On the left, we have a host decoy trap, and inside that tent, we can put carbon dioxide. In the middle, we have a CDC light trap, and we can have this associated with carbon dioxide and capture mosquitoes based on carbon dioxide. And on the right, we have a bed net trap where we have a box filled with solid carbon dioxide, dry ice, and that produces carbon dioxide. And the mosquitoes are attracted to that and fly under the tent here. As Leo mentioned, mosquitoes fly and host seek close to the ground, with our HLCs as an example. Mosquitoes would fly close to the ground, enter the tent, and then get trapped inside this bed net tent because they thought there was a human or a cow in there. That's another method of mosquito sampling. Gravid traps are available from Biogen, and they actually use uh, uh, sampling. They use things that mosquitoes look to oviposit. And even though these are usually used for Aedes sampling, I listed them out here because some species, not all, not many, some species of Anopheles can also be sampled with gravid traps. Window exit traps. Now, these are traps in which we try and sample mosquitoes that are exiting structures. If you remember, mosquitoes enter households to blood feed. They may rest on walls. They may exit, and usually through windows. any aperture, windows or doors. So here we can look at the number of mosquitoes that come inside and exit throughout the night. For example, if we do this every if we put a window exit trap on a house, you can see over here on the left, it's placed outside a window. And on the right is a very large window exit trap. I do not know why it was that big out a window. And mosquitoes exiting that window will be trapped in this large net box. And so, for example, if you look at indoor aspirations or PSCs in the morning you can see the number of mosquitoes that are resting on walls. But if you put a window exit trap, you can see the number of mosquitoes that entered that house to feed and left before you did your PSCs. So you can look at the total number of mosquitoes that entered your house, the number that were remaining in the morning, and that's relevant to IRS, and the number that left before the morning, and they may or may not have rested. So IRS may or may not impact those mosquitoes. So you can look at the overall, the proportion of mosquitoes coming inside the house, the proportion that leave before the morning, and with your PSC, you can look at the number that are remaining on the walls. Larval surveys, of course, are to look at larval sites, which ones have the Anopheles species-specific larval sites. And I think I reused the same pictures from a previous slide. And you can see the different kinds of larval sites, and a lot of these are based on the species. Different species usually select different larval sites. And so your optimal mosquito collection method is based on your question, right? And your question dictates your indicator, and you'd want to select your collection method based on your indicator, based on your question. So when we ask what mosquito, it's important to ask what mosquito behavior does the available trap take advantage of, because that will tell you how appropriate it is for you collecting that indicator. It's super important to understand how your local mosquitoes or your vectors behave with the trap. And here is where I was completely fooled by mosquitoes. In southern Zambia, in Choma area, CDC light traps at this point in time when we were working there were quite good at collecting Anopheles arabiensis. And then we had this study in Namibia, right across the border in Zambezia province. And we decided, and I thought, haha, I know everything, right? And I think because across the border, the Zambian mosquitoes can be caught in CDC light traps, we can implement CDC light traps in Namibia. And I was absolutely and completely wrong. The local mosquitoes in Namibia did not like CDC light traps. We did not catch any mosquitoes in CDC light traps. In fact, when we switched to HLCs, we completely caught a lot of mosquitoes. And here is where I was completely wrong. And the local mosquitoes completely disagreed with what I thought. And understanding what the local mosquitoes do and how they are behaving is more important than me assuming that they will listen to what I think. So traps have their positive and negative things, and you need to understand these based on your site, based on your local mosquitoes. And it's important to pick your trap, pick your sampling method based on your question. And here's another example, how different mosquitoes behave with different traps. So in the top panel is from Lampung in Indonesia. On the left is indoors, the white, and on the right, the gray is outdoors. And you can see each method is listed below. There are HLCs, CDC light traps, the Ifakara tent traps, resting boxes, and resting jars. And on the left is the number of mosquitoes on the y-axis. And you can see each sampling method worked differently indoors in white and outdoors in gray. In Lampung, HLCs indoors and HLCs outdoors work best. We did the same evaluation in Purworejo in central Indonesia, and you can see in Purworejo, the HLCs outside worked best. And in Halmahera, which basically drove me crazy because I sat there for weeks doing HLCs and caught almost no mosquitoes. And the second we put a goat-baited trap out, we caught a lot of mosquitoes. So you can see how the same mosquito sampling methods utilized both indoors and outdoors caught different mosquitoes, different species, different amounts at different sites. So it's super important to understand that your trap efficacy is location-based and is based on your local vectors, right? Because you might be putting out a trap and not catching any mosquitoes, even though there are a lot of them, and your assumptions based on that might be completely wrong. So your sampling method that you use can actually completely change your data, right? Yeah, HLCs versus CDC light traps in Namibia completely changed my data. HLCs versus goat-baited traps in Halmahera completely change your data. And just from these examples, you can see at every one of these three sites, different sampling methods captured completely different numbers. So there are trap evaluations. We have conducted trap evaluations at multiple sites, and at every site, uh, a different one worked differently. So understanding this at your site is so important. So here's a question so I've repeated this a few times, so apologies if you've heard this. Uh, there was a site where a country decided to put an IRS, and they put an IRS with deltamethrin because they said they did their standard WHO larval surveys. They did with their larval catches, they raised them to adults as recommended by WHO, and they found low resistance, almost no resistance to deltamethrin. So of course they decided, yes, our mosquitoes are resting indoors. Let's use deltamethrin in IRS. And malaria went up. It did not go down. And they were like, what's happening? And so we decided to try and figure out what was actually happening at that site. So our question was, remember to start off with a question, is which species are impacted by IRS? Are there multiple species there? Are they resting indoors? Are they insecticide susceptible? Does IRS actually impact biting densities? So these were our questions to try and understand which species are impacted by IRS or if they're impacted by IRS. And what we did is to understand overall what's happening at the site, we wanted to understand the species indoors and species outdoors, if they were resting indoors or not. So with outdoor HLCs, we found species 1, which was susceptible to the insecticide. Outdoors, we found species 2, which was also susceptible. And just from this data, IRS is not going to impact both these species in this location because it's outdoors. They were not resting there. And there's no IRS outdoors. Based on window exit traps, right, we could see that mosquitoes were entering houses with our HLCs, and they were leaving the house without resting. And this was species 2, the same one that was biting outdoors. And they were susceptible. So species 2 was, first of all, biting outdoors. It won't be impacted by IRS. Species 2 was entering the house at night, feeding on people, and leaving and not resting. So species 2 was not going to be impacted by IRS. And then we had species 3. We were capturing them indoors in HLCs. We were capturing them indoors in PSCs. They were resting on walls. And very frustratingly, they were resistant. So now we have 3 species, all 3 species with different behaviors. And 2 of them were susceptible to the insecticide, but their behaviors were not resting on walls. So they were not impacted by IRS. And the third species was resistant and it was resting inside. So we had 3 species that were not impacted by IRS. But when you look at what people did, what the country did, which was actually appropriate, with low resistance in species 3, they were capturing that, but they were not associating that with their behaviors. And understanding the species composition and the behaviors and how that interacts with your intervention is so important to understand how and what is actually happening at your site. I hope this is a good example of what actually happened and how appropriate entomological surveillance and thinking through things can actually help you understand what's actually happening and how to better protect people, of course. So it's important when deciding on sampling methods that there might be interactions between them. For example, if you want to understand the human biting rate, as well as your indoor resting rate, you don't want to do the same things in the same household. And that is because, just for example, if you're doing it at the same night, all your mosquitoes you capture in your HLC, you are not going to capture with your PSC. So your PSC numbers will go down. In addition, if you do your PSC in a house and you're spraying that whole house with insecticide, the next day, if you do your HLC, your mosquitoes might not want to enter that house and feed because there's a lot of insecticide, a lot of poison in the house. I would not want to enter a house with a lot of poison. So each sampling method might impact the other sampling method. So it might be good to separate your sampling frames for each method. So you are collecting representative data and not having each method impact the other method. A second point is that a well-designed sampling framework can capture data to answer more than one question. And an easy example is HLCs can look at species composition, it can look at a vector composition, it look at your human biting rate, it can look at your seasonality, it can look at your indoor biting rate, your outdoor biting rate, it can look at all these things. So select your sampling methods to direct it at your indicators, and you can collect multiple indicators with each sampling method and save on cost and time and money. A lot of times I see people having sampling frameworks with CDC light traps and HLCs. And my question is, why do you want to duplicate that data set? Is there a good reason for doing that? Because there might be a good reason for doing that I don't understand. But if there's a good reason for doing it, do it. But if it's not, take it out. Minimal essential data sets. So on table 8, on page 20 in the ESPT, you can reference sampling methods and how to actually, what it's appropriate for. So on the left, you have your sampling method, HLCs out here, and the mosquito behavior that it takes advantage of. You can see that over here, human host seeking, the host preferences there, and what indicators that the sampling method is appropriate to collecting. And that's in all the sort of the blue-green boxes. You can look at vector occurrence, vector density, and they're all listed out here. As a note, there are examples of methods, of sampling methods listed out here as well. So this is a table you can cross-reference to help you make decisions or to select a sampling method based on your indicator. On table 9, you have on page 21 is details of each sampling method, so that if you've never used it before, you can just reference this to try and overall understand what people who have used this across time and across geographies, all their feedback on it, because this is based on feedback from many, many people. So you have your sampling methods on the left and what common names are there, and various aspects about them, about positive things, negative things. Can it be used to determine if an intervention is appropriate? And can it be used to determine, to evaluate an intervention after it's in use? So there are multiple things about each sampling method that are listed out here that we hope you will find useful to reference before using it. So, and the next, almost the last slide, I think, is selecting lab analytical techniques. So once you collect your sampling, once you sample your mosquitoes, now you want to analyze them, and there are a whole bunch of things you might use. The first thing is to identify to species, and that's Anopheles keys, morphological identification keys. If you have sufficient resources, you can do molecular identification, and this can be done with PCR directed at some species, PCR diagnostics, or you can do sequencing directed at other species for which there are no diagnostics. And of course, these require more funds and more capacity. Salivary gland dissections are kind of hard to do, but you can look at infection rates there. Ovary dissections can tell you the age of your mosquitoes. These are also a little complicated. ELISAs can tell you the sporozoid infection rates to looking at EIRs or entomological infection rates. You can look at blood meals, which species the mosquito might have fed on based on PCRs or ELISAs. You can look at PCRs to detect parasites in the mosquitoes. Note that when you use PCR, to look at parasites in the mosquito. It doesn't tell you the infectiousness of that mosquito. If that mosquito is infectious to humans, it just tells you if the mosquito had a parasite in it, and it could be because of a blood meal, right? The mosquito might not be infectious, but it would become positive because the blood meal had a parasite that might get digested. It just detects DNA, not infectious parasites, while ELISAs detect infectious parasites. Then, of course, there's the CDC bottle assay and the WHO tube assay to look at insecticide resistance. There are biochemical methods, PCR methods to look at various insecticide resistance mechanisms, such as KDR. And of course, there are cone bioassays to look at the efficacy of an intervention over time. And this can be done for IRS or bed nets. As for all the previous example sampling methods, each of these methods have their own requirements and positive and negative points. So your optimal mosquito sampling methods should be based on your indicators and your question. It's important to consider your mosquito behavior, the local mosquito behavior that your trap takes advantage of. And it would be ideal if you can validate your sampling method, ensure that it's actually useful in collecting appropriate data for your geography and for your local mosquitoes. That is my last slide for this section. And give me a second while I change slides. Ooh. Where is stop share? I've lost this. Ah, there it is. So the next presentation is on sampling frameworks. I hope you can see my slide set. And I hope that the 2 minutes while I am confused and trying to figure out which slide set to actually pull up gives you a short intellectual break, and you can think about other things and laugh at me. So in this module here, we look at sampling design. So we've asked our question, we've selected our indicators, we know what sampling methods we want to use to collect our indicators. We're now going to look at sampling design. I might have missed site selection, but we can come back to that. So the key points in sampling design, the key concepts is our sampling site, our sampling unit, and our sample size. The sampling site is the collection from where mosquito samples are going to be collected, where we're going to obtain the data to collect the indicators and answer our question. The sampling unit is an individual unit for mosquito collection. And this, for example, can be a house, it can be a village, or it can be a larval site. The sample size is the number of sampling units we're going to be collecting from. For example, the number of houses we're going to be using to collect mosquitoes. So our sampling size per village might be 5 houses per village. So the various steps for sampling design, there are 5 steps listed out here. And step 4, we have already just covered, which is the sampling method. So I will go very briefly over that. The first step is to determine the sampling site. Where are we going to collect our samples from? The second step is to determine the sampling unit, which might be a house. So in step 1, we have a village. In step 2, we decide the unit is going to be the house. The step 3 is to select or allocate the sampling units. So we select which houses and how many of them. And step 5 is to set this frequency of sampling. How many days are we going to collect samples for sampling? How many days are we going to be sampling? 3 days, 4 days, 3 days a week, 3 days a month? How often are we going to go back? Every month, every week, every 3 months? So all this is part of the sampling framework, and going through this step by step will enable us to properly have an appropriate sampling framework. Now we'll go through each of these steps. First of all, determine the sampling site, right? The sampling site is I've just realized I've skipped a presentation, but we will come back to that. And it's this it's how to pick a sampling site. So we will come back to that and after this presentation. So the sampling site, selecting your sampling site is based on your question, of course. And you would base, once you select your sampling site, and we will come back to that, apologies for my normal confusion. Selecting your sampling site, let's say over here in this picture, it's a site in Mozambique. We have selected the sampling site where we're going to collect our data from. Sampling sites are selected, of course, based on our question, and we want to ensure that we fit the sampling sites and the number of sampling sites and the logistics of getting to the sampling site and back to our central location based on our capacity and resources. And a lot of times, we can't do every single sampling site we want because we don't have the funds or we don't have the number of cars. So determining the sampling site is so important. Once you pick your sampling site, here's an example of appropriate sampling sites and specific questions. Let's say our program question is, where are the villagers in village X exposed to Anopheles mosquitoes? Now, an example of a sampling site would be village X. We'd go to that village, plus areas where people in that village are exposed to mosquito bites. So now, for example, if the people in that village, a lot of them work in the forest, uh, and we want to understand where the people are being exposed to mosquito bites, we would actually sample in that village and the forest where people go to. If they're fishermen, we'd be sampling where people are fishing. If they have farms, and they spend the night in the farms, we'd probably want to sample in the farms because we want to understand where and when people are being exposed to malaria and what interventions are appropriate at that site. For example, if they're sleeping in the open air in farms, we cannot use bed nets, right? And understanding that is important. The second question is, in two health facilities, two of them are reporting high numbers of malaria cases, and we want to understand what is causing this. Entomologically, what is causing this? What aspects of mosquitoes are driving the cases up in facilities A and health facilities A and B? And an easy way of understanding this is all the people that report to health facility A and B. So all the villages, all the catchment areas that report to A and B are where our sampling sites would be, correct? So we'd appropriately select representative villages or houses or whatever our sampling allocation unit is across the catchment areas for facilities A and B. Our third question is there insecticide resistance to the active ingredient used for IRS or bed nets in region Y? And of course, if it's a Ministry of Health data collection, all Sentinel sites in region Y can be used, right? Where the intervention is deployed. So here you can appropriately select your sampling site based on your question. And I hope those three examples were good examples. And here's an example of a site in Mozambique, I think, where we were trying to understand drivers of malaria. And the orange is where we selected our sampling sites, quite a few of them. The next step is to determine the sampling unit. Now, a sampling unit can be multiple things, right? Based on the indicators we are collecting. It can be a house, as you can see on the right, that's a house in Tanzania. Or it could be at the bottom, which could be a larval site, and that's a larval site in Indonesia. The sampling unit must align with your priority question and your indicator, of course, right? For example, if you're looking at indoor resting rate, your sampling unit would be a house, right? The indoor resting rate per house. If you're looking at HBR, inside, it would be your human biting rate inside, and outside, and it would be a single home or a single unit, or domestic unit. All sampling units must be standardized across your study. If you're doing your HBR, you want to do your HBRs by house. But if you also want to look at HBRs in the forest, you'd calculate the HBR for houses separately from that of forests. But if you want to look at the overall exposure, you might want to combine them. And this, of course, would be based on your question. What is the question you're trying to ask, right? You want to standardize your sampling units across. So example questions that correspond to sampling units are outlined here. On the left, you can see how is IRS affecting the indoor resting density of anopheles in village X. Your indicator is indoor resting density. Your sampling unit is a house, and here are possible sampling units. You might want to do, based on your question, you might want to look at sprayed houses. You want to look at structures with different kinds of wall types because your indoor resting density might be different in mud huts versus concrete structures versus zinc roofs, etc. You want to look at houses where people sleep every night. You want to might look in uninhabited houses, right? And if your question is associated with things like Anopheles stevensi that likes resting in cattle sheds, imagine you might want to even select cattle sheds as your sampling unit. It completely depends on your question. Your next question is, what is the human biting location of Anopheles in village X? So now your indicator is your human biting rate because you want to look at your human biting location. And your location is, let's say, your houses and other structures where people are, where they are being exposed to mosquitoes. So you probably want to look indoors and outdoors, houses where people live, and spaces where people are actually present. And this is actually weirdly important because in some places, like in Zambia, there are outdoor cooking shelters where people spend a lot of time and they might be exposed there. And that is where we might want to do our sampling. Something we found is that, for example, in places like Kenya, where there are, for example, at funerals, they can be all night long funerals where people spend the night time all night long outdoors, and they might be getting exposed to mosquito bites. Or very weirdly, bars. People go to drink outdoors in like local bars. They might be getting exposed to mosquito bites, and not many studies are going on in those areas. Or even when people are working in fields or in forests, and it's really hard to collect data there. But those might be areas where people are getting exposed to mosquito bites a lot. So understanding your sampling unit is based on your question. Oh, I forgot about all these animations I just had in there. Now, once you pick your sampling unit, which could be a structure or a house or a larval site, you want to allocate them and pick the ones that you want to select either randomly or use them over your entire study. So allocation of sampling units means the selection of sampling units that will be included in the entomological study. To be able to do this appropriately, you might want to consider historical data and all the aspects that might impact your study outputs. If you want representative data, for example, indoor resting, you might want to select representative structures. You might, if your village has 3 different kinds of structures, one with concrete walls, one with wood walls, you might want to select both those types so you understand what's happening across the community. And once you select these sampling units, you want to understand how many, right? You want to select them. So how many of them will you select? So in step 1, we selected the sampling site. It's step 2, we selected the sampling unit. And in step 3 here, we select the specific sampling units over here in this example, 2 houses to follow over time. And here, for example, here's a village this is the Mozambique site in which we were trying to select randomly units. And these are the ones we actually selected to follow throughout the study. They were randomly selected, they were based on house construction, and they were based geographically across the entire village. So we got an understanding of exposure and human biting rates across the village. Now in step 4, we'd factor in the sampling method. We have already been through this, so I won't go through it again. It can be any sampling method based on your indicator and question. There are all these aspects of selecting your sampling method that we have already been through. So I will not go into this slide in too much detail. Now that you've selected your sampling unit, we want to select the frequency of sampling. How often do we go back? How often do we collect data? Is it monthly? Is it weekly? Is it once a year? A lot of the time, very unfortunately, this is based on available resources. And right now, I'd like to point out the difference between academic scientific data collection and operational data collection. With science and like scientific studies, with research, a lot of times there is enough and sufficient resources available. We have enough funds to collect all the data we can that is statistically valid, statistically reliable. But a lot of times with operational studies, especially with ministries of health, we do not have the available resources. We have limited budgets. So how do we set the frequency of sampling to get appropriate data collection that's representative, that we can actually collect good enough data to make decisions on? So I will go through this in the next few slides, and hopefully this will make sense. As you might understand, oops, sorry about that. As you might understand, more frequent sampling will give us more data, which will give us better representative data of our site. But overall, even if you cannot sample a lot, cannot conduct a lot of sampling, please remember that data quality, the quality of the data you collect, the effort you put into getting good data is more important a lot of the times than the quantity of data you collect, right? So for example, here are several options. You can see in this example below in the little graph, we have month 1 to 12. I completely made this up. And let's assume that the transmission season, the mosquito season, is month 6 to 11. Option 1 is you can go back to that structure, to that village, to your sampling site every month. Option 2 is you can go back every second month. Option 3 is you can go back every third month. And option 4, let's say you don't have many resources and we want to directly collect what's happening in the transmission season. We can ignore the dry season when there's less transmission and just collect at the beginning and the middle of the transmission season. So we want to get our sampling frequency to not just map to our question, but also map to our resources. How much sampling can we do with our limited resources? Right. So we set the frequency of sampling, and this is the timing of sampling periods, right? As I mentioned, it's largely based on the question and available resources. And here's an example of the timing and frequency of sampling. Now here the question is, what is the residual of efficacy of a new insecticide being used in IRS? So we want to understand how long the insecticide lasts after spraying. If we have enough resources, an option is to sample immediately following spraying. Immediately after IRS, we start sampling and we do it monthly until Anopheles mortality falls below 80%, according to WHO recommendations. So let's say this is 8 months, we can do it monthly for 8 months. And in option 2, if we have less resources, we can start immediately following spraying and do it every 2 months. Right? Or we can do it do it 6 months after to see if it's still efficacious, right? Or until Anopheles mortality is below 80%. So based on our question and based on our resources, we can adapt our sampling framework to fit within our budget, within our capacity to answer our question. So here's a question that I get a lot. How much do we actually need to sample? Because there's no real instructions on you need to collect from 5 structures 3 days a week every month for 2 years. No one says that. There's no real guidance on that. And the primary point here is that academic studies, as I just pointed out, require statistically significant data. However, operational studies require representative data. We want data to represent the site that might not have statistical significance. What we want to do is maximize our data quality with our limited operational budgets so we can make good decisions. And here's I hope this example works for you. So if you imagine we do a whole bunch of sampling to look at human biting rate. And on the left, on the y-axis, we have the human biting rate. And over here, you can see 8, so it's 10 mosquitoes per person per night, 12 mosquitoes per person per night, 14 mosquitoes per person per night, and so on. And let's say we collect data from 200 houses. So this is actually based on real data. Uh, and now we randomly go to one house and see how many mosquitoes we catch. So when we look at one house all the way on the left, we see, of course, you have huge amounts of variation. You can get 16 mosquitoes per house, so all the way down to 4 mosquitoes per house, right? You have a spread of data because you just collected from one house. If you get two houses, right, you're averaging them out, randomly select two houses. So instead of having a wide spread, right, you have a smaller spread of data. And as you add in more houses, you can see the data spread becomes less and less and less and less. So if you can collect data from 200 houses, which is a lot of houses, you can see that the human biting rate or your mosquito capture rate or whatever your data point is, it's about 11.5 mosquitoes per person per night, or mosquitoes per structure, or mosquitoes or anything. So the actual data is probably 11.5 when you collect from 200 households. But when you go less, you can see there's a spread of data, right? And so now more sampling is better, but this, of course, costs more. So at which point in this data spread, in this example, do we actually think is enough structures? And this is completely dependent on your your budgets and your capacity. So I just wanted to show how we might select this. So, and as an example, here's an example, and this is based on actual data from Mozambique. So we were looking at the species compositions at a site, and you can see we caught I think it's 9, 1, 2, 3, 4, 5, 6, 7. Yeah, 9 species, different numbers of each species at this site in Mozambique. So when we are looking at species composition, our question is, what is the species composition at our site? When we did a whole lot of sampling over an entire transmission season, we got 9 species, and you can see the numbers of each. Now, if we look at it statistically, right? Statistically, academically, research-wise, professor nerds like us with a statistician, if we want to go back there and understand if all these species are still present the next time we collect, the next season, to be able to collect at least one mosquito of each species to confirm that it's there, as relevant to the previous year, we need to collect 4,750 mosquitoes to ensure that all these mosquitoes are there. That's a lot of mosquitoes, right? You can see in the first season, we didn't catch that many. We caught 131 plus 573 plus 62 and so on. Excuse me while I have a sip of water. Thank you. So the probability of catching at least one mosquito species recorded for every species is on this graph. And you can see statistically, we need to collect 4,750 mosquitoes to capture at least one. And if our question is, are all these species present in year 2? This is the number of mosquitoes we have to collect. However, if we change our question to only the primary vectors, if our question is, are our primary vectors present at our site in year 2? And the primary vectors, let's say, are Anopheles phoenensis, Gambier, and Maculopalpus. And now here, we just have to capture 40 mosquitoes, statistically, 40 mosquitoes to capture at least one sample of each of these species to see if it's still present. So you can see we can adapt our question for our budget, for our capacity. And if we're focusing on the primary vectors, we just have to capture 40 mosquitoes. But if we're focusing on all vectors, we have to capture at least, actually more than, that's 100 times, right? More than 100 times more mosquitoes, which would require a significantly larger effort. So again, what is your question and how can we adapt our question, adapt our strategy to our budget? So how many do we need to sample? I just went over this, and now I'm going to go over in context of an intervention evaluation, right? So now our sampling, the number of mosquitoes per house per structure is outlined here. Now, again, I made up this example because we did not actually do this, but this is real data. But this example I'm going to show you is here. Now, if we have an intervention and we put it into place and we assume that the sampling rate, the number of mosquitoes go down, right? So so here, this is what I made up. I put the second figure here and made it up. What we assume is the number of mosquitoes per house per night will go down from 11.5 originally, and we put in an intervention and it goes down to 10, right? Now, let's say this is what actually happens. But how does our data collection allow us to interpret the results? If we have just one household, you cannot see the difference. If you have 50 households, again, please, this is just an example, and reality might be quite different. In this example, 50 households, you might not be able to tell a difference because the two things overlap so much. But when you go to 100 households, you do see a clear separation. So in this example, this made-up example, you might want to sample 100 households to look at pre and post-intervention to see if you found a result. And I'm stressing on this is a made-up example, and usually the numbers are not this high. It should not be 100. It can be much lower. I think when I was putting these figures, overlapping these figures, it just worked out well, because if I move one figure down, it overlaps much less and you can't see both. So this is just an example. So I hope this lets you understand how the amount you actually sample can allow you to answer your question appropriately. And understanding the background to what's happening is really important. What is your question? That what leads everything. So by now, we have learned to or gone over how to identify a priority question, how to select our indicators, how to go over methods, and how to select our sites and our sampling framework, but we have not gone over survey types and site types because I skipped that presentation, which I will go through now. Apologies for that. So all the tick marks are completely wrong because I missed one completely. But let's go over capacity and funding. First, before going back to the presentation I missed. So we went through what is your question, indicators, sampling method, site selection, and sampling design. We did not go over site selection. But now we've designed the perfect study, right? In our minds, we have gone through everything that has resulted in an ideal entomological surveillance plan to answer our question, right? But now, how does this fit with our funding and capacity? Maybe we don't have enough funds, and that happens all the time. But because you've gone through an ideal surveillance plan, you know what is essential. You know the minimal endpoints you need to collect. And now you can take this and go back to your indicators, right? Select, can I take out some indicators? Can I, what are the essential ones? What are the nice to have ones, right? And then based on the sampling method, you might be able to use a cheaper sampling method. With your sampling framework, you might be able to reduce the number of structures and therefore fit your sampling, fit your entomological surveillance to your funding and capacity. And that will give you a plan where you understand everything that is completely applicable to your question. I hope that made sense. And now, before I further embarrass myself even more, I'm going to quickly go to the presentation that I missed that I cannot find. And that is sampling 5, 6, 7. No, actually, I am wrong. I included, again, color me jet lagged, blame me jet lagged. I included site selection in this present, how to select your site. I went over that. Apologies, I am jet lagged and confused as usual. Sorry about that. I did go how to select sites, go through how to select sites. The next presentation is managing entomological data. I will actually go through all my slide sets to ensure I didn't miss anything. And this will probably be tomorrow when y'all can yell at me. And I'll let you know what I did wrong or if I actually missed anything. So managing entomological data. So there are two presentations here that don't have anything to do with entomological surveillance that are actually, to me, really important. You've spent all this effort, all this energy. You're out in the field.
Neil,
Yes,
yeah, sorry, I'm not sure if you want to stop at this point. We've run out of
absolutely.
time. Is this a convenient point to stop?
Absolutely. I was not even paying attention to time. So thank you,
Okay.
Leo, for
Yeah,
interrupting.
great. Yeah.
Thank you.
So I think we've run the full two sessions of 60 minutes.
Oh,
And again, from all of us, Neil, excellent, excellent training, well presented, easily digestible with your inimitable style. So thank you for that. You can see all the hands going up in deep appreciation. So yeah. So we're going to move on to 20 minutes of Q&A. Neil, should I do what we did
share, please.
yesterday and share screen?
Perfect.
No, I've got to work out how to share screen as well. Oh, there we go. Okay.
Please don't be as confused as I am.
Um, yeah, see if this is the right one. Do you see my screen?
Yes, I do. Yes.
All right, so day two. This is, I think it's about 12 questions or so spread across the spectrum from right at the start of the day to the end of the day. So just selecting some questions across that time span that seem to be general questions that a good number of the audience members may benefit from, rather than very narrowly specific individual questions. So the first one is from Sergio. Thank you, Sergio. How can we ensure that the data generated by entomological surveillance is used directly in local decision making at all levels, from district, provincial, and central? So this is not quite vector surveillance. It's a more philosophical, speculative question, but I think it's very important and relevant. So we're just asking you to speculate a bit, Neil. How do you
You
think one can get people to actually use the surveillance data?
This is so important, and it has been a struggle. So I know all of you understand how important entomological surveillance data is. You can see it just from these presentations. Now, how do we convey this importance to decision makers? That's part of the issue, right? How do we convey the data and the outputs? And I actually have a short presentation on this tomorrow. How do we make them understand how important it actually is and how we can further protect people better? And seminars and training sessions like this that we're going through now actually enable us, give us the tools to actually communicate this better. Ideally, we would use our entomological surveillance data alongside epidemiological data and intervention data. And the people who make the decisions will understand the importance of all these different sets of data together towards best protecting people. When you look at different levels, such as local, district, provincial, and central, as you mentioned, it's really important to see how the country is sort of centralized or decentralized. Who are the decision-making people? If it's decentralized, we need to work on the district or provincial level people, if they have the decision-making power, to enable them to understand how important their power is with the data we have. And if it's central level, it's the same thing with them, right? So we work with ministries of health. How do we, I'm saying educate, but that's probably not, maybe it's enlighten. How do we enlighten them to how important the work we do is and how it can actually change protections and enable better protections towards malaria elimination? It's a difficult philosophical question, but we all need to work on it together. Yeah. I hope
Uh,
that was sufficient.
Yeah,
Yeah.
no, that's great. I mean, Neil, you can spend an hour trying to respond to
Yeah.
that question, but it is a very, very, very relevant and important question. So,
Yeah.
Dr. Sharma, welcome aboard. Very grateful that despite your decades of expertise and experience, you are still interested in joining sessions like these. So, welcome, Dr. Sharma. It's Dr. Ranjanda Sharma, I think it's him from India. If the number of vector species specimens are low, how do we comply with the recommended number of individuals as prescribed in the WHO protocol to test for insecticide resistance? How do we build up adequate sample size per species? Yeah.
Yeah. This is completely a valid question, and it's quite difficult because WHO says to do something and the mosquitoes refuse to listen. And there's basically nothing we can do. We report on the data we can collect. So the thing is, if we find one resistant mosquito, and you only have 10 samples, you have resistant mosquitoes and you can report on that. And when you do report, you can say, this is what we actually could do. This is what we could find. And these are our results. If we do not have the required numbers of mosquitoes and all are susceptible, we can report and say we only had 23 mosquitoes. All were susceptible, but this does not say that there are no resistant ones out there, right? So we can do what we can based on WHO protocols, but the important part is reporting what was actually done and the limitations of it. Other than that, I don't know how to magically multiply mosquitoes. You can use F1s, but the data is biased because you have a limited number of founder females. You can use adults, but then you are including metabolic resistance and a whole bunch of other resistance mechanisms that might develop while the mosquito is alive with small amounts of exposure. So if you were using a WHO protocol, I'd stick to that, but report the limitations of your data based on the mosquitoes you get. I hope that made sense. We're just following like the protocol.
Yep,
Yeah.
absolutely. Thank you, Neil. There are a number of people who are raising their hands and would like to do in-person verbal questions. Unfortunately, I mean, there are about 900 of people still listening in. We cannot accommodate all those hands coming up. So we're just going to go through the written questions. I'm sorry about the practical limitations. It's just an unfortunate situation. So Ajalne asks here, can people not sleeping under bed nets get some degree of protection from bed nets hung and used by other people inside the same house? Again, not vector surveillance, but a relevant question, I think.
Absolutely. Yeah, it's completely relevant. The answer is yes. So if I use a bed net, I'm impacting the mosquitoes in my structure, in my household, and the mosquitoes that are susceptible will die. And those dead mosquitoes can't bite anyone else in my household, right? It can't bite anyone else in my community. So if it's called community effect. So people using an intervention will impact the entire mosquito population, and that impacts exposure on other individuals. And of course, your bed net usage has to be above a certain amount to have community impact. And I think it's 80%, if I remember correctly. And it's the same with any intervention, that above a certain amount of use of that intervention, you will have a community effect that actually protects other people who are not using the intervention. Yes.
Thanks for that insight, Neil. Next one, Nelson Kwamba, who says, thank you, Prof, for this masterclass. While it is relatively easy to collect, relatively easy, yeah, everything's relative, entomological data, I don't see how it would be easy to obtain data on community behavior. Could you elaborate and explore a bit more on community data? How would we obtain data that are representative?
Thank you. Great question. And hi, Nelson. Haven't seen you in a while. We are actually collecting this human behavior data in Mozambique right now. And Nelson's from Mozambique. And so you can do it in two ways. The easiest way is to align it with, let's say you're doing HLCs and I'm doing an HLC. At the end of the hour, I have a sheet. And on my sheet, it says the number of people awake, number of people asleep, number of people using a bed net, number of people not using a bed net. And I'm collecting the data at the end of the hour, the last 5 minutes, I just write down the number. No additional people, no additional effort, just a sheet of paper. You fill in the data, what people are doing at the end of the hour in that location, inside or outside. And you can do that throughout the night. And every night you can get the human behavior observations for that night associated with those mosquitoes. So the humans in that structure and the mosquitoes in that structure are perfectly related because they're collected at the same time. You can also do this with community questionnaires, where you could distribute questionnaires to the community and ask them what time they go to sleep, what time they're awake. You can do this again by sex, by age, by vocation. That data is not always, it's good data, but it's not actually directly related to observed data. Because with questionnaires, people tend to try and please the questionnaire, the person asking the question. So you do get people reporting higher bednet usage than if you observe bednet usage. So there are limitations to that, but you can also conduct data that way. So community questionnaires or directly observe the data. I hope that helps. And yes, you're right. It is difficult collecting data like this. And ideally, this is actually a really good point. Imagine you're in your house and someone is doing an HLC. Would you like this strange man in your house to observe you sleeping, your family, your wife, your kids, every single hour of the night? The answer is absolutely no. So here's where we have to adapt our data collection to align with ethics, to align with what the community will accept and want. So here's when we usually have a member of that household, like the brother or the father, so a person living in that household, actually conduct the HLCs and conduct the data collection. So we are not intruding, we're not doing anything unethical in that structure. So even though it's difficult to collect, methodologies such as this can enable us to better collect and respect the households better. Thank you.
Thanks, Neil. Malaku Petros asks, true or false, data on indoor resting density is only required if you are considering indoor residual spraying in an area?
I would say true and false. It's, true because indoor resting indicates the proportion of mosquitoes that will be impacted by IRS, but it'll also tell you species composition. It'll tell you seasonality. It'll tell you all these other indicate, or it can answer all these questions based on indoor resting. If you associate your indoor resting collections with HLCs, you can look at the proportion of mosquitoes coming inside houses and resting on walls and the proportion that leave outside. There are all these basic science questions you can ask. But if you're directing it only, if you're operationally trying to understand IRS, then yes, indoor resting collection is the specific indicator that will answer the question.
Thank you, Neil. Next one from Naimul Hassan. Do we have a commercial smart IoT-based camera inbuilt mosquito surveillance traps?
I wish there was one that was affordable.
Yeah.
So I think there are a couple that are being developed, one by Microsoft, but I'm pretty sure they're really expensive. Uh, if you email me, I'll send you information on them. Mike Reddy is actually looking after one of these Microsoft is actually developing this, helping developing it, and there are a couple of others. But email me and I'll send you information on them. But none of them are actually operationally valid right now until the price comes down significantly.
Yeah,
Thank you.
Naimul, I can also just mention, as it happens, APMEN had a webinar, I think it was in early November last year, and one of the speakers was someone from South Korea. And their university department had developed one of these, the exact kind of trap that you are talking about, that can separate out, well, first of all, record the number of mosquitoes coming in per time period that you specify, let's say each hour, and they can separate them out into different genera based on different parameters that they measure by, and in some cases even species. But like Neil is saying, it costs. So I mean, you can try and access that webinar and have a look at that particular presentation. Sergio Mala, how can countries with limited resources, such as in Mozambique, maintain effective and continuous entomological surveillance without international funding? Good luck, Neil.
You are, so Joe, this is the question we're all asking. With the recent changes globally, the recent horrible, unfair, ridiculous, makes me angry changes globally. We won't go into details about why and who. Uh, it's really frustrating. A lot of entomological surveillance and worldwide activities are unfortunately based on external support. How do we change the paradigm where countries are not aid dependent, right? And if we try to think of this as a positive thing, it's not a positive thing, but how do we think about it as a positive thing that can elicit change where we are not dependent on external funds to protect our own people, to conduct our own entomological research, our own entomological surveillance? How is there any way to elicit local funding from our own country? How do we get funding from our own country so we're not dependent? Like all these questions are being raised right now. So we're not dependent on someone with a different agenda in another country who doesn't even know us or think about us to make a decision that impacts all of us, right? How do we think differently? The answer is there's no answer because I honestly don't know, besides changing systems where more funds and capacity are diverted to important things like this. And as an example, I know that in Mozambique, at present, entomological surveillance is actually being reduced or cut because of these global changes. And that's just so unfortunate. And I think it's the first step in changing this historical paradigm of aid dependence and external dependence on things like this. And I hope it really changes where we are far more proud to conduct our own surveillance, our own activities with our own funds. I hope that answers. It doesn't answer, but I hope it represents something positive and a good change.
Geez, Neil, it suddenly struck me that some excellent work is being done by Goodbye Malaria in Mozambique, but I think they're dependent on
Correct.
American funding. So it would be, I'm scared to ask the question, how does it affect them? But okay, here's a question from Drake. Drake, you ask, why is the human landing method the gold standard, despite it having a lot of risks, such as arboviruses and so on? How is it better or more appropriate than using CO2 baited traps?
A great question. So we'll back up a bit and ask about the HLC and the indicators it collects and the questions it answers. So if our question is trying to understand the human biting rate, the HLC actually almost directly measures the human biting rate, right? The CO2 trap doesn't. So just with that question, the HLC method actually is the direct, almost parallel observation of the human biting rate. The carbon dioxide or CO2 methods are slightly different. And we actually found this out if we're looking at CO2 baited traps. We found this out when we were evaluating the human decoy trap, where a mosquito uses multiple signals to get attracted to something. It's not just carbon dioxide, right? Why did they select humans versus cows? because we smell different, we look different, we act different. Why do I prefer fried chicken than fried shrimp? Because it smells different, it tastes different, it looks different. I definitely preferred fried chicken, just like mosquitoes prefer humans, right? And so a human landing catch will directly tell you which mosquito species and the number of mosquito species that are attracted to humans specifically. And when we say humans, we're incorporating humans, the smell, what they look like, their taste, their smell, like carbon dioxide, everything. Whereas a carbon dioxide trap is just carbon dioxide, and it takes out all these other factors, but that might be specific to a specific bait or a specific species. I hope that made sense.
Thank you. Yes. Two, you can respond very quickly to this,
Yeah.
but very practical questions. Jemina asks, what is the proper direction of placing a pot trap? Very pertinent for a field entomologist.
Yeah. Well, in my experience, it is not completely horizontal, but slightly off. So if this is the pot, slightly like that. So it doesn't collect water if it rains, even though you want some water in there, but it has a lot of dark area where mosquitoes can hide. So sort of like if this is a side, sort of like just like that. So there's a lot of dark area. Of course, my hand is not a very good pot. That's been in my experience, but different species might require different things, and your experience in the matter and at your site might be more important than my experience.
I
Thank you.
think also put it in the shade, a shady spot, and
Oh, thank you. Thank you. You're right.
facing away from the sun, so you don't get the sun
Exactly.
directly coming in.
Yeah.
You know. Uh,
Thank you, Leah, for clarifying that. Yes, thank
as
you.
as a leaf asks, as heat, hot water is one factor attracting mosquitoes in the host decoy trap. How can we keep the water warm overnight?
So you're right. So the water actually reduces in temperature overnight, but the container is big enough where if you put in water that is above body temperature, it's still warm. And by the morning, it's below body temperature, but it's still warm and it's warmer than the surrounding area. So it actually works throughout the night. The efficacy might differ over the night slightly, but overall, there's this warm area and a shape, and the mosquito is attracted to that. In my experience, in the morning, the water is still warm. Yeah,
Thank you,
thank you.
Neil. Gideon raised, just as an observation, Procopac is not mentioned, and then it was followed up several questions later by Abdul Malik. Can
Absolutely. Yeah.
we use the Procopac aspirator to understand the indoor resting density of mosquitoes?
Thank you very much for adding that in, and I will add that into my slide because you are completely correct. I think I do this like I use Procopac so much, it was just embedded in my head. You are right. Indoor aspirations can be conducted with Procopac aspirations. You can do outdoor resting collections with Procopacs as well. So when you do indoor aspirations, like you can either do it with a tube, as was in the picture, or with Procopac devices. Thank you for that. I will add it into my slide. You are correct. I will add it before sending it to Wulan to share with you. Thank you for that. You are right.
Uh, Thank you, Neil. Adane asks, I have a big question in my mind about sample size. I think you did actually deal with this issue
Yeah.
after the question was, but let me ask it. In my mind, sample size calculation, mainly how many houses we select for our mosquito collection, how we calculate optimal households for our collection, or should we be guided by expert resources? I think you dealt with this, Neil. Yeah.
Yeah, quickly, it's a great question, and the answer is completely dependent on resources. The more house structures we can collect, the better. We just want to make sure that we're not doing so many houses that we're not getting any additional data. I mean, that the data isn't saturated, but that usually doesn't happen. Um, I would start with like 5, 6, 10 households to see if we can afford it. And then if we can't, scale back a bit. And you can do 4 houses for 4 nights, or 3 houses for 4 nights, or 4 houses for 5 nights, and things like that. Work through the capacity you have to see what you can actually fit into your budget. And then cross-reference it with publications and like science research studies to see what other people did. You can also email us or email thoughts and questions to see, well, this is what I'm thinking. Does this make sense or not? And we can work through that as well. Happy to support you in that.
Thank you, Neil. I just want to, Dr. Rawadi Kumlat, you raised your hand. Sincere welcome. Wonderful to see you participating, Dr. Rawadi. Unfortunately, we're not able to accommodate verbal questions simply because of the sheer number of people, hundreds of people taking part. So, we've opted rather to go for the written questions that are short and tight and concise, and that we can kind of sift through. So please, Dr. Rawadi, tomorrow, because we've run out of time now, please just put your question in the Q&A box and we'll try and deal with it tomorrow. Good friends, our vector control community, once again, a wonderful afternoon or wonderful session wherever you are, whether it be morning or afternoon for you. Again, a highly instructive, enjoyable session of learning presented by our expert, Professor Neil Lobo. I hope everyone enjoyed it. The numbers are suggesting you did, because we still have well over 800 people still listening in, from close to 1,000 at some point during the session this afternoon. It shows a lot of people are retaining their level of concentration and interest. So it reflects well on your teaching as well, Neil. We look forward to seeing you all back again tomorrow for our third afternoon or third session of training. Thank you so much to Professor Neil. I'd also like to thank Dr. Mukhtar, as also Dr. Pon Sihain, and to Wulan for your technical support in making sure that the Zoom platform and so on, everything runs smoothly. Thank you so much, everyone. See you tomorrow. Thank you. Thank you, Neil.